Well, a warm welcome to today's update. Now, I'm going to be looking at the increasing cases in the UK and Europe at the moment. We've seen this new rule introduced that only 6 people are allowed to meet together in the UK. So is this justified? It does seem to be. There are definitely increases in cases in the UK, consistent with many places in Europe, it has to be said. And we're going to look into the COVID symptom tracker app and look at some clinical features that apply fairly specifically to children. Now, this is of immense importance because I believe that schools and universities are going to be the next epicentre. This could spread cases out to the wider community. And it's vitally important that parents are able to recognise clinical features in their children. Then they can keep them off school so they don't spread it and isolate them for the 14-day period, or at least until they get tested. So symptom recognition, which are often very mild in children, is very important. There's a very brief update on the Oxford vaccine, but not much detail on that yet. And then if we get time, we'll be looking at the importance of speaking quietly and why that is a good idea at the moment. Right, let's get into the detail here. Now, this is from the UK. Let's just start with the graph from the UK, actually. We can clearly see there's increasing cases. This is from the COVID symptom tracker app. So these are symptomatic people. So they underrepresent the real number because there's an additional symptomatic group as well. But we can see we're over 3,000 cases per day now in the UK. And in fact, we can look at that on the Our World in Data as well. And we see that the cases are increasing. Now, we're looking at, as we see here, this is out of date now, of course, we're over 3,000 now. This is the 7-day rolling average. That's why it's always behind. But in a sense, that's useful because it actually shows that there's been quite a rapid increase in the UK just over the past few days. It's a significant change. So these increasing cases. Now, we know that these cases were massively underestimated. And we did look at yesterday at the peak, there was a lot more cases per day than this. Perhaps 100 times, but perhaps 200,000 cases per day we were looking at the peak. Now we are genuinely at around the 2,000 to 3,000 mark. So this was massively underestimated because of the lack of testing at the time and the fact that people who were tested were mostly hospitalised and highly symptomatic. So we're not back to where we were in March or April. No one's saying that, but the direction isn't good. And of course, it's always the trend that we need to look at in COVID-19. So more than 3,000 daily cases at the moment, and these are symptomatic cases. Now, the COVID symptom tracker app tells us that gives an R value of 1.2. We know what this means. Every infected person is likely to infect 1.2 other people, which means by definition we have exponential increase. So the potential for a great increase in numbers is currently there. Now, what does the Tim Spector Group recommend to do about this? Local and regional restrictions, that they agree with a localised policy of targeting measures to particular areas and particular risk groups. And the cases are rising particularly in the north of England, Scotland, Wales, compared to the south of England at the moment. So that's kind of where we are at with that just now. Now, I think we'll just compare it with Europe because we have this trend that we are seeing, unfortunately, at the moment in Europe. Now, as we know, these peaks in all countries were underestimated, but this is where we're at now. So let's just go in and have a quick look at that. So Spain, unfortunately, are leading the pack, but just it's the steepness of the line that's concerning. The increase in cases is so much. I mean, Spain over 8,000 cases per day, France just under 8,000 new cases per day. Israel, a smaller population, but fairly steep line in Israel as well. We haven't looked at Israel for a while. United Kingdom going up, Germany a little bit behind the UK. So we do see that this is part of a European trend that we are seeing at the moment. But particularly we want to think this morning about children and getting back to school, because I think this is probably going to be the main risk as we approach autumn. So let's have a look at some information from the COVID Symptom Tracker app on this. Now, there's data from 198 children with positive tests and nearly 16,000 children with negative tests, and parents can log in the health of their children with a multiple profile setting on the app. Now, as you'll see, there's 198 children who have reported their symptoms who are known to be positive. Relatively small number, and the COVID Symptom Tracker app is desperate for more parents to use the multiple profile setting to report on behalf of their children. And I've been using the app for ages. I have no reservations about it whatsoever. So we desperately need more data from children. But having said that, this 198 positive children, as far as I'm aware, is still the biggest study in the UK. But of course, if it was a couple of thousand children, it would be much more significant data. But that is from there's still 16,000 children nearly without symptoms. So again, this is good data. At the moment, there's about 250,000 children on the app, but of course it would be nice to have many, many more, but not all of those are reporting every day. But important information coming out here. Under 18s who tested positive. Now, we know the classic adult presentation. We would memorise this: cough, fever, and the anosmia, the loss of the sense of smell. But 52% of children didn't have those features, any one of those features. So children are presenting in a different way to adults very often. So more than half of children didn't cough, didn't have fever or anosmia. They weren't presenting in the usual way in the week before or the week after the test. Now, children, high proportion of asymptomatics, about 33% were asymptomatic. 55% of children reported undue fatigue. So the implications here are really obvious. If your child wakes up one morning and says, "I just feel so tired, Mum, I just feel so tired, Dad," just think, could that be COVID-19, and keep them off school till they get tested. We need a high index of suspicion for these clinical features. Headache in children, 53%. This compares to the adult figure of 72%. So more adults are getting headaches. Fever, you see, under half of the children had fever. Surprising, but that's what the data is showing. Children, 38% had sore throats, whereas adults get more sore throats. The adult figure is 49% for sore throats. Loss of appetite, 35% of the children. Skin rash, 15% of the children. And I did check the United States Centre for Disease Control list of symptoms, and skin rashes is still not on. Come on, Centre for Disease Control, update your clinical symptoms. 15% of children, according to UK data, have skin rashes. Is it that children and people with COVID-19 in the UK get skin rashes and people in the United States don't? Well, I don't know, because you don't give me the data. Disappointing. It needs updated. Unless there is no skin rashes in the United States, which would be startling, and that could also be helpfully reported, then we would know. But at the moment, we simply don't know because it's not reported. Now, apps data on adults, loss of smell, 60% of adults, persistent cough, 54% of adults, not so in children. So let's just go over those again. The main clinical features to look out for in children. Quite a few are asymptomatic. Fatigue is the most common one in children. They're just tired. I mean, kids are supposed to be energy balls, aren't they? I get tired just looking at them running around. I mean, it's tremendous. I just wish I had a few percent of that energy. Like a pod of dolphins, the way they can erupt into the park or erupt into the house or something. That wasn't me. That was from Clive James. He described his grandchildren as having the energy of a pod of dolphins. But you know what they're like. They're just completely... completely active normally, but undue fatigue is abnormal in children. High index of suspicion, please, for that. We will catch a lot of cases and prevent a lot of spread. Headache in children, fever. Every house needs to have its own clinical thermometer. Have I got mine here? No, but normally I have one. I've got one in the house. Just one of these electronic ones, quite cheap, or some way of taking temperature is a good idea. Sore throats 38%, loss of appetite 35%, skin rashes 15% in children. So remarkably useful data there. More children would make the data better, but remember these were all in children that tested positive. So all these clinical features were in children that tested positive, and these were the most common of the clinical features. So something for every parent to know, and of course go onto the COVID symptom tracker app and get the full details yourself. Now, there seems to be a lot of fires in the world, and of course this can be confusing because you feel ill and you cough. So Amazon, there's an awful lot of fires. This is appalling, of course, in terms of deforestation, but the number of cases allegedly are going down now in Brazil. I haven't looked at it in detail, but certainly on our World in Data, the number of cases are going down, as they are in the United States. And I just wanted to extend our thoughts really to all the people on the West Coast. I mean, we expect wildfires in California, but now it's Oregon and up all the way up to Washington State. So 30 million people under red flag warnings. So the smoke inhalation is not good at all. But while we're on the United States, just let's look at the data, and we'll use that to lead us into India, which I want to look at as well. This is the position in the United States for, now this is the linear scale, 20,000, 40,000, 60,000, 80,000. So in the United States, the number of new cases is dropping off quite nicely, according to official data. Whereas in India, it's only going up. Now, of course, remember the population of India is 1.3 million. So the population in India is about 4 times that in the United States. So the per capita number is still, actually it's comparable now, isn't it? It's comparable per capita numbers now. But that's the direction of trend. So great to see the numbers going down in the United States. But of course, remember, we're still on over 30,000 cases a day. It's not gone away. That's still a lot of new cases in the United States. It's just that the trend is down. But talking about India, basically India is going to be the country hardest hit by this pandemic in terms of numbers. There's 1.3 billion people there. That's an unimaginable amount. 1.3 thousand million people. I just can't get my head around that kind of number. Very often living in very close quarters. 600 million people live in really quite significant poverty, very low quality housing, very limited access to healthcare. And as we approach the next few months, India is going to get a lot worse, as we've seen by those trends. Now, why am I saying that? Why am I being all gloomy about India? Well, the virus is spreading now, but the reopening is progressing quite rapidly. So we know there's so many community cases, and with the reopening in India, the spread, I'm afraid, is guaranteed. They're doing 1 million tests per day. Case fatality rate at the moment looks like 1.7. Now, the infection fatality rate, of course, will be much lower. These are the number of people that are diagnosed. But I've got quite a lot of anecdotal reports from India saying, oh, actually, I know someone who died of COVID, or a friend of mine died from COVID, or a friend of my parents died from COVID. And a lot of the deaths from COVID don't seem to be getting recognised as COVID. Because although there's 1 million tests per day, remember there's 1.3 billion people. So quite a few deaths are probably occurring that aren't officially diagnosed. But even so, the case fatality rate is about 1.7. Now, even if this is overestimated by 10, and it could be, that will give us a case fatality rate of 0.17 in India. And, if you're talking about 60-70% of the Indian population, to achieve herd immunity, you're still talking way over 1 million deaths in India because of the large population size. And I've got quite a few friends in India. There's all sorts of problems there. I mean, for example, a lot of the private hospitals have been ordered to take on COVID patients from government testing centres, but it's not funded. And what this means is the honest hospitals are doing it and incurring a huge loss. But unfortunately, all hospitals in India aren't as honest as that. So there's difficulties going on, and it's going to get worse, unfortunately, in India. Now, slightly encouraging news from Pakistan, which we'll just come on to in a minute. But next, let's go to Greece. Now, 3 migrant camps near Athens were placed in quarantine. So these have been closed off by the Greek authorities. So hopefully this means that there won't be significant spread outside the camp, as long as order is maintained. But of course, within the camps, the living conditions, by definition, these are temporary camps, are often quite crowded. So they could be quite prolific, exponential spread within the camps themselves. So concerning for the camps themselves rather than spreading to wider parts of Greece. Not a good situation at all, I'm afraid. They've been under restrictions since March, limited who goes in and out. Now, on the island of Lesbos, where there's a lot of refugees, the 35 cases were confirmed last week. Now, what seemed, well, no one quite knows what happened on Lesbos. The news isn't clear. But the Greek authorities rightly were trying to isolate these people, and it seems that caused unrest. And there was all we know is there's been a lot of fires. So the accommodation, which was already poor, has been devastated by fire, crowded conditions, 35 cases already, indicating there's probably some community spread. It looks like the attempts of the Greek authorities to isolate this have not been well received, and that means that there could be further spread. The Greek authorities are trying to instigate a major testing and contact tracing operation, but with 2 major fires, it's a fairly chaotic situation. So it looks like there's a lot of disorder. I mean, the camps are already noted for lack of order. Crime is rampant in the camps, which is unfortunate. There doesn't seem to be limited law and order, and now fires adding to the chaos. So it's a bad combination. Jordan, likewise. Now, the background here is that most of the Syrian refugees who've had to leave Syria because of the ongoing civil war, most of them are in camps in Jordan. There's now been cases among Syrian refugees in Jordan. Now, they have done well so far, because I'm surprised there's not more outbreaks in these difficult refugee situations already. So it's a compliment to the organisation in Jordan and Syria that this is the disease has been kept at bay for so long. But alas, it does seem to be spreading there now. Let's just hope the authorities can keep that under check. Jordan itself is resuming some international flights, so the situation in the rest of Jordan is actually not too bad. Now, having said that, a lot of the Syrian refugees in Jordan actually they don't live in camps, they actually live in city areas in Jordan where they get whatever work they can, of course. Jordan really needs complemented for the way it's absorbed, hopefully on a temporary basis, but so many Syrian refugees. And although the situation is difficult, it's a lot better than it would be if someone's shooting at you or bombing you. So we'll just monitor that situation. But it's inevitable that there will be more cases, I'm afraid. Now, Pakistan. Difficult to get data from Pakistan. We mentioned the difficulty in data in India already. There's a lot of reasons data is difficult in India, but Pakistan also difficult to get data. But there's a symptom of 2,000 people from the Aga Khan University in Karachi, and they're saying 95% of people are asymptomatic. Now, that's an awful high proportion to be asymptomatic. But this is a report from the Aga Khan University in collaboration with Pakistani health authorities. That's what they're saying. That's what they're saying. It's a remarkably high asymptomatic rate. We'll get more details on that as time progresses. But part of it could be that the median age in Pakistan is 22, which of course mitigates for high asymptomatic cases, but still not 95%. mean, we've just looked at data from the UK. What was the figure in children in the UK? Asymptomatic, it was 33% of children in the UK were asymptomatic, and that's children. And we know that there's less asymptomatic adults than children. So 33% of asymptomatic children in the UK. The Pakistani authorities here are claiming 95% asymptomatic. At the moment, all I'm going to say is that this is inconsistent with the data from the UK. That's all I can say at the moment. I recognise an inconsistency between 33%, or was it forgotten already? Was it 33%? I think it was, or was it 35? Anyway, 30% in children in the UK, 95% asymptomatic in Pakistan. You don't have to be a mathematician to realise there's a big difference between those two numbers. Now, polio, tuberculosis and hepatitis have been outbreak problems in Pakistan already, and polio really should have been eliminated, but there was, you might remember a few years ago, there was a polio eradication campaign that was targeted by terrorism. So, and healthcare workers actually giving the polio vaccines were actually attacked and in some cases killed. And polio is just the most wretched disease. I've worked with polio quite a bit overseas, and it just paralyzes children's limbs. It's a horrible, horrible disease, and it's been I think it's been pretty well eliminated now. In fact, it was eliminated. While polio is now eliminated from Africa, India, it's pretty well gone. Virtually everywhere. In fact, I think India might be polio free now. It's just various areas where that aren't polio free because of the lack of immunisation, because of superstition and terrorism. So, and that's that devastates children's lives. Devastates children's lives. I mean, yeah. I'm not going to go on about personal cases, but it's a horrible disease. So, infectious disease, big problem in Pakistan already. Successive governments, according to news outlets, have underfunded healthcare for decades. So, problems there. I do hope that 95% is correct. Now, the vaccine, unconfirmed reports. Now, just before I made this video, I logged on to the Oxford vaccine site, the definitive source, and they had not said what the complication was in the one person that got sick in the UK that resulted in the trial being suspended. They have not released that information as I came to make this video. But news reports are saying it might be transverse myelitis. We don't know. It may be. Now, if it is, transverse means across the way. So if that's the spinal cord, transverse would mean there's a lesion across the way like that. Transverse is the spinal cord. Now, we believe that the person that is affected is getting better. But transverse myelitis is an inflammatory disease of the spinal cord. Actually, most cases of transverse myelitis are called idiopathic. We don't know what causes it. So this does arise in the community from time to time. And given that tens of thousands of people have been vaccinated, this could be coincidental. But it can also be caused by viral infections and inflammatory reactions, immunological reactions to viral infections. That's why they're particularly concerned that this could be caused by the vaccine. But more on that in the next few days, hopefully. The previous case seems to have been a case of multiple sclerosis, which again, I think they decided it was unrelated because multiple sclerosis unfortunately does crop up. Now, Francis Collins, one of my scientific medical heroes, National Institute of Health, says they're going to apply an abundance of caution. It's a pity we haven't heard more from Dr. Collins. He's not really a sort of public facing, or the American media doesn't seem to have picked up on him particularly. But great scientist, famous doctor, well known from the Human Genome Project fame, of course, but now heading up the National Institute of Health. But he said this, and I like it. Science and science alone will be the way this decision is made. Otherwise, I will have no part of it. And the attorney, not the Attorney General, we're talking about the Surgeon General, said something fairly similar. But let's make that the quote of the day, shall we? Science and science alone would be the way this decision is made. Otherwise, I will have no part of it. And this is what we need to be guided by: good data. This is what we need to be guided by. Okay, now I've got another thing to do on aerosol transmission, but I think that's long enough for now, so we will leave it there for today. Thank you for coming back as always, and thank you for watching this video.